Hello friends, today we're going to talk about rhinoplasty. What is it, who can get it done, how it's done and its side effects. It is a surgical procedure for reshaping or repair of nose for cosmetic and medical purpose. Now let's talk about the types of rhinoplasty. The first one is cosmetic. It is mainly focused on issues related to the shape, size and proportion of the nose. Second one is called functional rhinoplasty, which help in breathing problems due to the obstruction in the nose, can be easily resolved by this method. Next, called reconstructive rhinoplasty, which plays an important role when it comes to configuration related issues of the nose. Last one is called revision rhinoplasty. In some rare cases, if the previous rhinoplasty is not up to the patient's satisfactory level, revision rhinoplasty can be done. Rhinoplasty can be done two ways. Open rhinoplasty, in which the small incision can be given on the top of the nose to achieve better shape, whereas the closed rhinoplasty is done by making few incisions inside the nostril to make it better medically or cosmetically. In the recovery period, the swelling and discomfort can be resolved completely in 1 to 2 weeks. Now let's talk about the risk of this procedure. Mild infection, no desired shape achieved or scarring is common risk involved in this procedure. If you think this video is helpful to you, please like, share and subscribe to our channel. Thank you.